How is it that under a Trump administration, Planned Parenthood is still receiving federal taxpayer dollars? And regarding Planned Parenthood, their cancer screenings, prenatal care, pregnancy tests are all in a dramatic decline. But you know what's increasing? Abortions. Joining me to talk about this and so much more is Dr. Michael New, a dear friend of mine who is at the Catholic University as a professor of economics. He also is with the Charlotte Lozier Institute. He joins me to talk about Planned Parenthood, the pro-life sphere in America, and even the midterms. Thank you for joining the program. I saw this post on X of yours, and whenever you post data, I'm always very intrigued because you get into the nitty-gritty. And I appreciate that because it saves me from getting into the nitty gritty, and it's great. So you posted Planned Parenthood released their 2025 report. The trend of more abortions, more taxpayer funding, and less healthcare continues. In the past 10 years, abortions are up 31.4%, and taxpayer funding is up 10%, while cancer screenings, prenatal care, and pregnancy tests are all in massive negatives. So one of the questions was, how are they still being funded? Because a lot of people thought, oh, well, the Trump administration came in and got rid of funding. What is going on?
Sure, that's a good question. Well, it's important to remember where this data comes from. And the data on government revenue, taxpayer funding, all comes from fiscal 2025. So when the Trump administration and the Republicans in Congress defunded Planned Parenthood last summer, that took effect fiscal 2026. So effectively, this is a Biden budget. That when the new president takes office, he kind of inherits his predecessor's budget. So this is the budget that was signed by Joe Biden. I'm sure when Planned Parenthood comes out with their report next year, looks at fiscal 2026 numbers, we will see a reduction in taxpayer funding because we did stop them from getting federal Medicaid dollars. But this looks at the previous year, a Biden budget where they were still eligible for funding and got, again, over $800 billion from hardworking U.S. taxpayers.
That's a very large number. I don't think people really understand or can grasp that as what the Biden administration was able to push through. So you said that was through Medicaid, correct?
A lot of it's through Medicaid. I mean, taxpayer funding comes from different sources. I mean, they get money through one point through Title X contraception programs. They get money through Medicaid. State Medicaid programs also fund Planned Parenthood as well, including the federal Medicaid dollars. Sadly, there's about 20 states whose Medicaid programs cover elective abortions. Because of the Hyde Amendment, federal lawyers don't pay for abortions, but some state Medicaid programs do. So that's a funding source for them. So even though we cut Planned Parenthood off as far as getting federal Medicaid dollars, they're still getting taxpayer dollars from other federal programs and from Medicaid programs in many states.
Okay, so is the Trump administration doing anything about that? I know there's been conversations about the Hyde Amendment. And for anybody who doesn't know about the Hyde Amendment, could you just explain that and then potentially what the Trump administration is doing to tighten that up?
Well, sure. The Hyde Amendment was first passed in 1976. And after Roe v. Wade, pro-lifers kind of realized that we weren't going to be able to overturn Roe v. Wade in the short term, but we want to do some things in the short term that would protect the conscience rights of taxpayers and protect some preborn children. So what we did was we passed a law called the Hyde Amendment, an amendment, I should say, that prevented federal Medicaid dollars from funding elective abortions. It was first passed in 1976. It was bipartisan. 99 House Democrats voted in favor. So it was one of our first big political victories. It was also our first big judicial victories. Like anything else pro-lifers do was challenged in court. We had to litigate it. And we actually won in 1980 in Harris v. McCrae. And we only won by a single vote. It was a 5-4 ruling that upheld the federal Hyde Amendment. But it's been part of every budget since that time. And for a long time it was bipartisan. 7 of the 8 budgets that President Clinton proposed include the Hyde Amendment. All 8 budgets that President Obama proposed include the Hyde Amendment. So Democrats for a long time didn't want to fight with us on the issue of taxpayer funding of abortion. That changed with Joe Biden. His budget did not include the Hyde Amendment, but thankfully we had Republicans in Congress who were able to get it through and preserve it. So, I'm pretty confident that, President Trump will keep the Hyde Amendment around. Taxpayer funding for abortion is an issue that polls well for pro-lifers, and most Americans don't want their taxpayer dollars funding elective abortions. So, again, we've been able to prevent that from happening since 1976, and lots of lives have been saved. Short of banning abortion, the best you can do, as far as getting abortion numbers down, is to defund it. And the research I've done for the Lozier Institute has shown that since 1976, we've saved over 2.5 million lives because of the Hyde Amendment. So I do expect that President Trump's budget will include the Hyde Amendment. Republicans do have a majority in Congress. It's pretty slim, but it does exist. And I think that the 2027 budget, which will be passed this summer, will include Hyde.
That's fantastic. And that's very clarifying. I think people will be able to understand much more so why this is happening because oftentimes when a new administration comes in, there is that carryover from the past administration. And then that current administration that's in power often gets blamed for the ills of the past. So that's very clarifying. I also wanted to jump into you posted about the JAMA network and some of the content that was coming out from them. Could you touch on that? What's happening there?
Yeah, we had some interesting news come out last week that the Journal of the American Medical Association, academic journal, not particularly pro-life, they published an interesting article that looked at maternal mortality rates in states after the Dobbs decision. And supporters of legal abortion are always trying to make the case if you pass pro-life laws, it hurts public health.
Mhm.
And I think in Oscar, the data does not bear that out. And this JAMA study was well done. It looked at quarterly maternal mortality rates for all 50 states and Washington, D.C. from every year from 2018 to 2023. And it found that in those states that passed strong pro-life laws, maternal mortality went down. Went down by around 2 to 3% in states like Texas and other pro-life states. That if you held various factors constant, you actually saw a slightly faster decline in pro-life states than in
Hmm.
states with permissive abortion policies. So again, the other side is able to cherry pick certain data points and cherry pick anecdotes, but a comprehensive study that looked at all 50 states for a decent amount of time did find that trends were pretty similar in both pro-life states and states with permissive abortion laws, and that maternal mortality is actually falling everywhere, and that's a good finding.
So what you're saying, Michael, is that pro-lifers aren't killing women. We actually are favorable to women. That's a good
Oh,
thing. That's a
absolutely.
good
I mean,
thing. I think
there's
the
actually a lot of
topic.
research that shows that international data actually shows that pro-life laws go hand in hand with good public health. Poland, which probably has the strongest pro-life laws of any kind of large population country in Europe, also has the lowest maternal mortality rate. Ireland,
Right.
before they tragically legalized abortion, they had lower maternal mortality rate than kind of peer countries like England, Wales, and Scotland. When Chile put some pro-life protections in place in 1989, their maternal mortality rate fell. So there's a lot of good research from around the world showing that pro-life laws are consistent with good public health. The other side doesn't report on this or give it attention, but the data is pretty clear.
Yeah, that's actually a really good point. I have to look into that on the international scale a little bit more. I appreciate the fact that you're able to bring this data up. It's really important. I also wanted to get your reaction on the DOJ, Biden's DOJ. That news just broke on how they had been weaponizing the DOJ to go after pro-lifers, and all this information is just being exposed. And I have friends who were personally impacted by Biden's DOJ. What did you think about that information coming out?
It was sad, but not surprising. I mean, the Biden administration, DOJ, really weaponized the FACE Act, which is known as Freedom of Access to Clinic Entrances. Theoretically, this act, should be, there to prevent abortion facility blockades, but also protect places like pro-life groups and churches and pro-life pregnancy help centers. But the Biden administration, by and large, only uses to prosecute people who engaged in civil disobedience, at abortion facilities. And a lot of these people who did so got very aggressive prison sentences of, 2, 3, 4. I think in the case of Lauren Handy, almost 6 years in jail. And I think it was just disproportionate. I mean, I think that the FACE Act is wrong. I think that situations involving civil disobedience should be just handled by trespassing statutes and local law enforcement. I don't think we need to weaponize the federal government in this situation. And it was just disturbing to read because, the Biden administration worked hand in hand, with abortion facilities, with abortion rights groups, and to really try very hard to single out, get people engaged in pro-life civil disobedience for, I think, disproportionate penalties. And thankfully, President Trump did pardon these individuals, which I thought was certainly the right thing to do. Thankfully, that the Trump administration made it very clear that the FACE Act is only going to be used in situations where there's loss of life or severe property damage. That other instances of civil disobedience to be handled by local law enforcement. That's a positive development. Again, sad but not surprising that our opponents would weaponize the FACE Act in this way.
Yeah, no kidding. And just reading through that, I encourage people to go read through. It's 800 pages long. It's a very long report, and so nobody's really probably going to get through all of it. But to go and actually read through some of it, it's really important to see that this isn't just a win in terms of the Trump administration exposing it with the Biden's DOJ's actions, but also taking action. There was actually some level of justice where some of the individuals who were either in judiciary or in government who were actually working and colluding with these pro-abortion groups and entities, that these people are actually fired or released from their positions. And so we don't often see that there's some justice. And so this wasn't just, I think, a pro-life win. I think this was a pro-America win at the end of the day. And seeing that was quite encouraging for myself, and it sounds like for you as well.
Yeah, I mean, this was interesting and kind of almost, I would say, unprecedented. Usually, justice departments don't, comment on how their predecessors acted, but the fact they were willing to issue a report and made it accessible. It's on the DOJ website. Anybody wants to read it. Again, it is long, but I would recommend that people do pick through it. That I am pleased that the Trump administration is kind of calling out the Biden administration on their misconduct.
Yeah, no kidding. And it's, I mean, it's of course very beneficial for pro-lifers to utilize this kind of information. And also what you're doing with the JAMA report, we're talking about the DOJ, Biden's DOJ, we're seeing a lot of positive trends, but I also want to briefly touch on maybe not so positive of a trend, but something that Senator Josh Hawley is kind of attacking in the best possible way is the abortion pill. That is something that is consistently coming up in conversations that I'm having, that I'm seeing in our circles and pro-life realms, but also now it's starting to hit the mainstream a little bit more, and how abortion pill access is kind of increasing the abortion percentages that we're seeing across America. So can you speak to that and maybe give us some statistics, some data points?
Sure. That Guttmacher released, abortion data from 2025, I believe, earlier this month. There's over 1 million abortions taking place in this country every year. We saw a very slight, like 0.2% increase between 2025 and 2024. And the main reason why abortion numbers are going up is because of telehealth abortions. That in states that have strong pro-life laws, women can go online, interface with a medical professional through Zoom or another online interface, and have chemical abortion pills mailed to her. So that really does a lot to undermine a lot of the very strong, very good pro-life laws that we've passed since the Dobbs decision. And the sad thing is the Trump administration could end this tomorrow, or even end this today if they wanted to. That telehealth abortions only started during the pandemic. It was meant to be a short-term thing during the pandemic when there were concerns about people visiting doctors or hospitals in person. So it was meant to be a short-time arrangement during the pandemic. The Biden administration continued this unwise policy even after the pandemic ended. And sadly, the Trump administration has continued it as well. I mean, again, the Trump administration, FDA, could change the rules. Prior to the pandemic, a woman who wanted to obtain a chemical abortion had to have an in-person visit with a medical professional. I think that chemical abortions are evil, but I will say that in a world where they do happen, it's best to have some safeguards. And an in-person medical exam is a good safeguard, because if a woman is in an ectopic pregnancy and obtains chemical abortion, that can be fatal. If she's further along in gestation, she realizes and obtains chemical abortion, that can have some very negative, serious health consequences. So it's a real source of frustration for pro-lifers that the Trump administration has not been more proactive.
Yeah, no kidding. Do you see any positive indication from the Trump administration that they might move in a direction of banning telemedicine or telehealth with regards to access to abortion pills, or is that just kind of something that they're leaving on the table and not going to touch?
Well, they say they're waiting for a study, that they are trying to do research. Now, I don't think they need to wait for a study. I think that it's pretty evident that there's some real serious health risks with these health abortions. So
Mhm.
they keep discussing a study, but the details of the study have been, to put it charitably, scarce. We don't know who's doing the study, what data they're looking at, when it's going to come out. My very strong hunch is that Trump's political team thinks that putting limits on chemical abortions is a loser politically, and they want Republicans to do well during the 2026 midterms. So I think it's possible we may see some action after the midterm elections come and go. I think that that's possible, but it does disappoint me. I think that when you have political power, you need to exercise, do good. You can't necessarily let political considerations trump that. And also, the polling data we have does show that people are really concerned about unregulated chemical abortions. I mean, there's a variety of reasons to be concerned. We have stories about partners and boyfriends who have put chemical abortion pills in their girlfriends' drinks or their foods and have induced abortions that the woman didn't want to have. I mean, there's a lot of reasons why there need to be safeguards, and the Trump administration really needs to show more leadership here.
Yeah, absolutely. And I love what you said there. When you have political power, you should be utilizing it. And we've seen that on the other side where those who are committing acts of, I believe, unrighteous and evil laws and passing them or having these mandates. It's interesting to then see our side per se, come into power, the more pro-life side, and be a little bit more cautious. And it's very interesting. I think people need to go more gung-ho on that. But with that being said, you brought up midterms. I'm so happy you did because this is a question that I've been asking everybody who comes on the show. And what do you see potentially the outcome of the midterms being? And what are some of the things, especially I guess for more the pro-life realm, that you see on a state level that people need to be aware of?
It's really hard to predict what's going to happen with the midterms. There's several months out yet. It's a cliche, but it's a true cliche. Lots of things can and will happen between now and November. Usually, the opposition party does well during midterm elections, and usually the president's party enjoys some success during when the president's elected, and then the opposition party tends to make a little bit of a comeback. Will that pattern hold for certain? We don't know. The one kind of wild card we have is that some of the, frankly, gerrymandering going on, that both parties are trying to redraw congressional districts the way that's favorable to them. There's litigation right now going on. How that's going to work out, I don't know. I'm not a lawyer. Both sides engage in gerrymandering. I don't like it. I think it's kind of ridiculous that a state like California, which has probably around 50 congressmen, there might be only 4 Republicans. In a state where maybe 40% of the state votes Republican, it just seems that people should have representation and there should be more competitive districts, not fewer. But I understand parties have incentives to draw these districts in a way that are advantageous to them. We do have ballot questions on in many states. There's going to be one in Virginia. That's going to be tough. I mean, Virginia is a state that's kind of trending more and more blue, that the DC suburbs kind of get bigger every year, and most of those people have liberal political views. We have a good chance to win in Missouri. Missouri did pass an amendment that placed abortion in their constitution in 2024, but they're coming back with an effort to repeal that. The initial polling I've seen looks good. Now we'll see if that holds up. But I do think there's a chance for a pro-life win in Missouri. There may be something also on the ballot in Idaho. These ballot propositions are tough. I mean, one thing we know from direct democracy is that the side that spends the most money tends to win. Abortion is a multi-billion-dollar industry in this country. The other side can often put more money into these things than we can. That said, we did notch some wins. I mean, we did win in Florida in 2024. Now, we were lucky because the other side needed 60%, not a majority. But, we did. We stopped them getting that 60% they needed. We also won in Nebraska and South Dakota. So pro-life wins are achievable, but we have to, be smart, raise money, run a good campaign, stay on message. We have our work cut out for us, though.
Yeah, no kidding. But that is true. We don't necessarily have as much funding as the pro-abortion side, but we are seeing some really good wins across the board, and we have to be paying attention though and very alert because just because something succeeds as you're talking, some things could potentially be repealed as well. So that's why people need to be very, very engaged in midterm elections and not just fixate on when a president's being elected. So I thank you for that. Is there anything else that you'd like to add that people need to be aware of? Work you're working on right now, things in the future?
Well, we're very excited. The 50th anniversary of the Hyde event is coming up in September. I'll have a new study out about lives saved, and I think that we need to, anniversaries are great because when you celebrate an anniversary, you get to win again. So I'm looking forward to that. And I would just always want to encourage people that we're this for the long haul. Pro-lifers would never promise a smooth glide path to victory. The post-Dobbs years haven't necessarily gone exactly the way we thought they would. But again, we have to sometimes be happy with incremental progress, and there's all kinds of good things to build a culture of life.
Yeah,
Prayer,
absolutely.
raising money, giving money, swing pregnancy help centers, sidewalk counseling. I didn't sign up for this because it was easy. Probably chances are neither did any of you. We just need to keep up our efforts. That it will bear fruit in the long run.
Yeah, and you're a man who actually does what he says. I remember going out to the DC Planned Parenthood and working those sidewalks and ensuring that every single woman who came across us and we came across them that every single Saturday they had someone presenting a life affirming option. And I thank you for that because I've seen the fruit of that.
Yep, I'm pretty proud of the sidewalk ministry I help organize outside the DC Planned Parenthood. I say it's both the best and the worst thing I do every week. Honestly, it's not always fun parking myself out there for a few hours, but I will assure your listeners, if you spend time in prayer outside these abortion clinics, lives will be changed by your presence.
Yeah, absolutely. I remember talking with one of the individuals who was on the Planned Parenthood side who would, what do we call them? It's not a
Well,
escort.
the death scorts, the
The
death
death escorts. There
scorts.
we go. Very specific terminology. So one of these death escortees, I ended up forming like some sort of friendship with him, and we ended up having some really great conversations. And I made him think. And that's sometimes you are the one planting the seed, sometimes you're watering it, sometimes you're bringing the harvest. So you just never know what, but there's going to be a benefit no matter what to you being out there. So I thank you for doing that. I thank you for serving with the Charlotte Lozier Institute. And you're also with the Catholic University, correct?
Yep, full-time professor at Catholic University. I teach economics here at CUA. So, lots of good things are happening on campus. We're really trying to strengthen the Catholic orientation of the school, and good things are happening.
Yeah, no kidding. Well, thank you for what you do, and God bless the work of your hands.
Thank you.
The Bible warns about deception in the last days, but what if one of the great deceptions is what you believe or don't believe about the rapture of the church? I dive into that and much more in my latest book, They Lied to You About the Rapture.